How do you taper off Suboxone? Suboxone is a medication prescribed to treat opioid addiction or opioid use disorder. It is a combination of buprenorphine and naloxone and comes in tablet or film form. When used as directed, Suboxone can help people reduce their cravings for opioids and eventually quit using them altogether. If you are considering tapering off Suboxone, you must do so under the guidance of a doctor. In this video, we will discuss the process of tapering off Suboxone effectively and safely, and what you can expect along the way. Let's get started. People stop taking Suboxone for different reasons. It includes people who feel like they have beaten their opioid addiction and no longer need the medication. Others may find that Suboxone is no longer working for them, or they may be experiencing unpleasant side effects. There are also circumstances when you should stop taking Suboxone, even if you don't want to. These include: if you are pregnant or breastfeeding, if you have liver disease, if you are taking certain other medications, such as sedatives or tranquilizers, if you have ever had a seizure, if you developed an allergy to Suboxone. No matter your circumstance, if you're thinking about stopping Suboxone, you must speak with your doctor first. Your Suboxone doctor would be able to talk to you about other possible treatment options and help you plan a safe and effective way to taper off Suboxone. Suboxone is a medication used to help people addicted to opioids. It works by helping reduce cravings and withdrawal symptoms. However, Suboxone is a potent opioid that can be challenging to stop. If you are thinking about stopping Suboxone, you must speak with your Suboxone doctor first. They can help you find the best plan for tapering off the medication. They can also recommend other treatments, such as counseling or therapy, to help you through the process. It is also essential to have a support system in place when you stop taking Suboxone. It could include family, friends, or a support group for people recovering from addiction. With the proper support, you can successfully stop taking Suboxone and start on the road to recovery. Tapering off Suboxone starts with a plan. Your Suboxone doctor will work with you to create a plan that suits your needs. It may involve slowly reducing the amount of Suboxone you take over time, or switching to another medication before stopping completely. Once you have a plan in place, it is crucial to stick to it. Sometimes you feel like you can't do it, but it is essential to remember why you are tapering off Suboxone. The longer you take Suboxone, the harder it may be to stop. Your body becomes used to the presence of Suboxone, and stopping can cause withdrawal symptoms in only a matter of days. These symptoms will be difficult to deal with, so it is crucial to have a plan in place before you start tapering off Suboxone. As you taper off Suboxone, you will likely experience withdrawal symptoms. These symptoms can range from mild to severe, and they can include anxiety, insomnia, nausea, dizziness, vomiting, diarrhea, muscle aches and pains, sweating, irritability. Aside from these physical withdrawal symptoms, there are also mental and psychological symptoms. These can include depression, anxiety, mood swings, cravings for opioids. You must be aware of these symptoms before tapering off Suboxone, as dealing with them can be challenging. However, there are ways to manage them. With the help of your Suboxone doctor and support system, you can get through them and start on the road to recovery. For those who are addicted to opioids, Suboxone can be a life-saving medication. However, because it contains the potent opioid buprenorphine, it can also be addictive. As a result, many people who take Suboxone find themselves struggling to taper off the medication. This is a bad situation to be in, as it can lead to a relapse into opioid addiction. However, there are ways to taper off Suboxone successfully. The good news is that there are a few strategies that can help. It is the first and most crucial step in successfully tapering off Suboxone. A certified Suboxone doctor knows how to help you taper off the medication safely and effectively. So talk to them and be honest about your situation, plans, challenges, and goals. Your doctor will likely want to see you more frequently as you taper off Suboxone, so they can monitor your progress. It will help your doctor make necessary adjustments to your taper plan. They may adjust your dosage or change your medication altogether. You must follow your doctor's instructions and not try to taper off on your own. Tapering off Suboxone on your own can be extremely dangerous. The same is also true when quitting cold turkey. Suboxone is a powerful medication, and suddenly stopping it can cause severe withdrawal symptoms that you might not be able to cope with on your own. So, always work with your doctor when tapering off Suboxone. Tapering off Suboxone usually takes several weeks or months, depending on the individual. This process should be supervised by a medical professional. The goal is to gradually reduce the dose until the person is no longer taking medication. Set a timeline with your Suboxone doctor to know exactly how long the tapering process will take and what to expect. It will help you stay on track and motivated throughout the process. It will also help you prepare for any challenges that might come up. A support system is essential when tapering off Suboxone. So be sure to share your plans with your family and friends. Let them know what you're going through and how they can help you. Finding a support group or online community of others going through the same thing is also essential. Sharing your plans and seeking support will give you a sense of accountability and help you stay on track. It will also make the process a lot less daunting and more manageable. If you're feeling overwhelmed, seek help. There are many resources available to help you taper off Suboxone successfully. A few of the resources that can help you taper off Suboxone successfully are therapy and detox programs. These programs can provide you with the support and guidance you need to stay on track. They can also help you deal with any challenges that might come up during the process. Therapy can help you address the underlying issues that led to your addiction in the first place. It can also help you develop healthy coping mechanisms for stress and triggers. Detox programs, on the other hand, can help you manage withdrawal symptoms and make the tapering process a bit more bearable. Both therapy and detox programs are essential resources to help you taper off Suboxone successfully. Be sure to take advantage of them if you can. Making healthy lifestyle changes is another crucial step in successfully tapering off Suboxone. It might include changes like eating a healthy and more nutritious diet, exercising regularly, getting enough sleep, and managing stress. These changes will help you feel your best and make the tapering process easier. An unhealthy lifestyle can make the tapering process more difficult. For example, you might experience more intense withdrawal symptoms if you're not eating well. And if you're constantly stressed, you might be more likely to relapse. So you must make the necessary changes to support your sobriety. Making lifestyle changes can be challenging, but it's essential for successfully tapering off Suboxone. The length of time it takes to taper off Suboxone will vary from person to person. Factors like the severity of your addiction, how long you've been taking Suboxone, and your overall health can affect how long tapering off takes. In general, the process takes several weeks or months. Relapses can make the process take longer, but it's something that often happens during tapering, so it's essential to be patient and stay focused on your goals. If you're struggling to taper down your dosage of Suboxone, you're not alone. Suboxone is a powerful medication, and tapering down can be difficult. However, there are some things that you can do to make the process a little easier. We're here to help you every step of the way. We offer a variety of resources and services that can help you taper off Suboxone successfully. Our Suboxone doctors are prepared to work with you to create a customized tapering plan. We also offer therapy, counseling, and detox programs to help you manage withdrawal symptoms and make the process more bearable. Contact us today at 888-444-9628 to learn more about how we can help you taper off Suboxone.